on the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. 6:23 is the time now. Sometime during your lifetime, you've had or will have a cough that you just can't seem to get rid of. Dr. Devon Ballard is here today explaining the difference between a chronic cough or a regular cough. Dr. Ballard, good to see you as always, sir. Thanks for joining us. We have the lungs right here.
Yes.
So I imagine that, when someone is coughing, maybe mucus is coming up. Chronic cough, regular cough, difference between the two. What should people be looking for?
Chronic cough usually in adults is something that's persistent, like 8, 9, 10 weeks. Kids usually 4 or 5 weeks. So It's not just if you have a cold and you're coughing for 5, 6, 7 days. So it's more the length of the cough itself that's persistent that usually is the issue. That's how you delineate chronic versus kind of acute kind of cough.
How common is a chronic cough? I mean, how often do you see it whenever kids come in or people come into the clinic?
In an ambulatory setting, it's actually the most common complaint you'll see.
Really?
Yes. Like 30 to 40% of people coming into a doctor's office will have that as part of a complaint. Sometimes it's not just cough, but my ears hurt, coughing, congestion, fever, but cough is we hear that regularly.
I'd mentioned mucus, which a lot of times we associate with wintertime, having that gunk that just won't go away. Yep. Is that associated with the chronic cough as well? Is that something to look for?
It can be.
Okay.
So a lot of different causes. I mean, so we talk about cough, there's a multitude, but there's a lot of common things that cause a common cough or a chronic cough. So in Arkansas, it's asthma, allergies for sure, tobacco use, either smoking tobacco or the vapor use, and reflux is a very, very common cause of a cough, how it presents with people.
Okay. Any type of, I don't want to say cures for the cough, but that is something that people want for, hey, doc, give me a cure. I need something to get rid of this thing. I got to go here, doing this. My job, I've been out for a couple of days. What do you guys usually recommend as a starting point?
So we usually just do a full exam and assessment history. Yeah. I mean, literally you can kind of tease out, is it, you think it's more reflux associated? Do you think it's more allergies, depending on the history and exam itself? Because sometimes there's certain findings. For example, allergies, you'll see, swelling of the nasal turbinates. People have what I call allergic shiners, or like kind of the raccoon eyes.
Yeah.
They got to have that allergy face. On the exam, you might hear somebody wheezing. Well, they have a seasonal type of asthma, or is everything up here normal, but they're having a kind of a hoarse voice, kind of a chronic cough. Well, you might have to think about kind of a reflux type problem. And another thing that is very common is medicines. So there's a certain class of medicines that can cause a chronic cough called ACE inhibitors. So a lot of people hear about the medicine Zestril, lisinopril, ramipril, all the prils.
Yeah,
it's the weirdest thing. So you can be taking medicine for 20 years and the cough can come on, or you can take it for two months. So it's a strange type of bradykinin reaction. Literally, you stop the medicine, it goes away. So that's a very common. You have to look at medicines that people are taking. Is that a possible culprit or not?
Okay. So some things to look out for.
Oh yeah,
for sure. And of course, drinking some warm tea with honey and lemon will
just
help.
Hydrating well helps a lot. A lot of times dry air will do it, so humidifiers help also. So.
All right, some good advice as always from Baptist Health. You can contact Baptist at the number or website on your screen. Dr. Ballard, good to see you as always. We'll see you next time.
Appreciate it.